Hello friends, I'm Dr. Pritam Kataria. I'm a medical oncologist at Sir H.N. Reliance Foundation Hospital. As we know that 4th of February is celebrated as World Cancer Awareness Day, and we'll be speaking about something about cancer to create awareness about it. Now why it is important is because the last few decades has been the other causes which have been very important in terms of causing morbidity and mortality in human beings, but cancer is something which is coming up in this decade and could be a big epidemic in coming years to come. And so it is very important to understand what is cancer, what is the incidence of cancer, what are the causes of cancer, and why the incidence is rising. Now, as we all know that what is cancer is something which is uncontrolled proliferation of our own cells. So these cells which are sort of controlled by our body gets uncontrolled, they are out of the control, they are no longer controlled by the human immunity, and so in that situation they become very uncontrolled and cause many more cells. Now when we sit in our clinics, the common question asked is the incidence of cancer rising, and why is it rising? Definitely the incidence of cancer is rising, and that we can see from the global statistics that it is increasing to many extent, and it is further going to rise, and this could be attributed to many factors. Now let us understand what is the common cancer in world as well as in India. While we understand that the most common cancer among the world is breast cancer, lung cancer, oral cavity cancer, while in India among males it is oral cavity cancer, lung cancer, while in females it is breast cancer, cervical cancer. What you can understand is that the most common causes, I'll enumerate it now. Now there are some factors which are modifiable and some factors which are non-modifiable. Like few causes which are where we cannot modify anything. For example, male sex are predisposed for a prostate cancer, while female sex are predisposed for a breast cancer. While age, as you grow older, there is more propensity to have cancer. That doesn't mean the younger age is sort of defended from a cancer. They may also have a cancer. Hereditary. So something which is hereditary is not in your hands or anyone's hands. So that is one of the other risk factors. Now there are other modifiable risk factors. So one of the most common factors and spoken a lot about is tobacco and tobacco related products. Second is smoking, alcohol. The three most common factors to cause a lot of cancers in our body, but most specific being the tobacco and the tobacco related products. Now we look at the other cancers where the specific causes could be there. For example, if you look at this cervical cancer, which is the second most common cancer in the females among India, it is human papilloma virus infection, for which we have different vaccines for the prevention. For breast cancer, the factors could be early commencement of menses or late menopause. Other could be not having children, late marriages, obesity. These are the common factors that could be attributed for. So I think these are the risk factors that we need to be mindful about, and some of these factors are modifiable and we can reduce the incidence of cancer in our community. Is there need to worry? Not really, because there are different treatment modalities that have developed, and what we need to understand is creating cancer awareness is something very important. So we increase the awareness of cancer and remove the fears of the mind from the different people. Thank you.